Dr. Mault, thank you so much for joining us here at Abu Dhabi Global Healthcare Week. I want to ask you how you imagine we're going to see devices that can monitor you in real time evolving.
Well, it's an exciting time. I mean, when you look back at the practice of medicine, it's really all about collecting data and observations, making a diagnostic interpretation, and then hopefully a treatment recommendation. So it's about gathering information from the human body. And we've struggled, frankly, for the last century to spend a lot of money and manual labor to collect a small amount of information. And so we all started to experience a breakthrough about 10 years ago with the wearables, the Fitbits and the Apple Watches that was almost an epiphany that we can start to collect data from the human body without exerting a lot of effort to collect that information. So this has now evolved to the work that we've been doing here with, in the Emirates in particular, to develop medical grade wearables. And that's kind of an elevation from where we were for the fitness and exercise market, to be able to now have something that can make the same measurements from the intensive care unit, but on any patient anywhere, whether it's in the hospital or at home.
What do these medical grade wearables do exactly?
Well, what they do is make the measurements that we've been paying doctors and nurses to do for the past 100 years. Heart rate, which we've seen in our sports wearables, but this is heart rate with EKG and pulse oximetry and respiratory rate, body temperature, and all sorts of things. Body position, for instance. Being able to know if someone is laying in the same position for too long, which is a big complication. So now these sensors can monitor, has this patient been turned in the last so often, so that we can prevent things like skin breakdown. To be able to then have all this data go up to the cloud and have, I know we call it artificial intelligence, we'll talk about that, but algorithms that can watch the data and start to see things that we've never seen before.
The trends.
The trend, exactly. And what this does is, compared to what we've been doing, which are snapshots of information, and if the snapshot is once every 6 hours, that means a lot of bad things can happen in those 5 intervening hours. So now we're moving, because of medical grade wearables, to continuous monitoring. And what continuous monitoring does is gives you the benefit of seeing an early subtle trend.
Yes.
But we can't rely on humans to keep all that in their heads, so then we use computers to watch the data and look for those trends. And if we can see those trends, whoa, now I can do something about it before it becomes the code button.
Yeah.
Right.
Beyond the hospital scenario, do you foresee you and I wearing these kind of medical grade wearables out in the real world, just to kind of keep that, I guess, record of what's happening with our bodies?
Yeah, there's no debate. I mean, this changes everything. Again, I'm a cardiac surgeon, so when we would send people home, even today from the hospital, your family member goes from having all these doctors and nurses checking on them to suddenly nothing, right? And that's
terrifying prospect.
Well, it is, and I almost think it's cruel for the families, because you're suddenly putting all this responsibility on them and saying, pat on the back, here's a list of things that you should keep track of, and if dad has a problem, it's kind of your fault, right? And that's a real burden on the families. But now imagine being able to go home with a little wearable device that's going to allow the nurses to keep monitoring your loved one, and if there's something starting to brew, they'll see it and bring it to your attention. Say, hey, your dad's starting to show some things. Let's bring him into the doctor's office, and be able to effectively preempt.
Yes, pre-treat.
Pre-treat what would otherwise end up being something that got worse and worse until you're calling the ambulance.
Yeah.
So the data now is really exciting. We're seeing dramatic reductions in trips to the emergency room and even rehospitalization after discharge because of a medical grade wearable that can go home with the patient. But in other ways, when we think about our children, right? As a father and a physician, it's agonizing when your children get sick, especially when they're little ones, and you're putting them to bed at night with
with fear in your heart.
With fear, and now they can have a little sticker that's going to monitor what's going on. Mom and dad can go to sleep, and if there's a problem, it'll alert them on their phone and say, hey, Johnny's starting to spike a fever. And you can share that with the pediatrician. So then the pediatrician can say, it's nothing concerning, it'll be better, or hey, bring them in.
Yeah.
So, and then when you think about even life insurance policies, we send somebody to your house to take one set of measurements and a little sample, and then they go back and they price your insurance policy. But imagine now they're going to send this little wearable in the mail, and you're going to wear that for 2 weeks, and it's going to see every heartbeat, every breath, how you move, how you sleep, and then create basically an analysis that says,
this policy works for you.
This policy is going to be, easy, and we'll be able to keep it at a low price. And if you put this on once a year, just like we're starting to put sensors in your car, and if you're a safe driver, you get a discount on your car insurance. Well, it's going to be the same thing here. If you're willing to wear one of these and share the data and show that you've got healthy behaviors and you're not smoking and you're active, you shouldn't have to pay as much for your insurance.
In your mind, how does the collection of all of this data today evolve? And I mean that in terms of artificial intelligence, the data that's collected, all of the different paradigms. It's fascinating because there'll be so many different things that we're going to be able to, as you say, preempt than we've ever been able to do so before. How does this evolve in your mind over the next decade?
Oh, it's literally going to be looked back upon as one of the most profound moments in the history of human health. And I'm not exaggerating that. It will be on par with the invention of X-rays, the development of vaccines and antibiotics. It really is about to have that profound impact. And so what people need to start seeing are all of the incredible benefits to our daily lives, to our children, to even think about, if you have a child that's going to a summer camp or for your school athletics, getting the physical for your sports, the sports physical. Now your child will just have a little button, they'll wear it for a couple weeks, it'll print out a report, and that's going to see things that, frankly, your doctor generally might miss. And if your child has a heart problem, a lot of times that's not seen until suddenly there's a tragedy on the basketball court. And we saw that, even with LeBron's son, right? And those things can be seen with these types of technologies. And then AI will recognize a pattern and say, hey, before this becomes a tragedy, we can do something about it.
Yeah.
So we just have to start being open-minded and watch for these incredible benefits that are about to come.
So we're here at Abu Dhabi Global Health Week. This is the inaugural event of this forum. In your mind, what role does the UAE have to play?
Oh, the UAE, and I've been spending a lot of time here over the past couple of years, is a remarkable showcase for innovation and a drive, what I would call capital to capability. And what you've got is a prepared society and leadership that's really committed to leveraging the capital and the resources and the opportunity, especially for healthcare. There's clearly a commitment to the greater good, and not just for Emiratis, but I think to be able to disseminate that through the region and then be a global showcase for technology-enabled healthcare. They really demonstrated that excellence in their success with the COVID pandemic here. I mean, they had the lowest hospitalization rates, they had the highest testing rate, they had the highest immunization rate. It was frankly remarkable.
Yeah.
And it was the envy of the world, frankly. And the rest of the world was struggling. They're shutting down hospitals and canceling surgery. And here they, again, it was decisive leadership and, a level of commitment and intelligence to apply technology smartly and also public health policy.
Dr. Mault, it's great to have you here at Abu Dhabi Global Healthcare Week. Thanks so much for joining us.
My pleasure. Thank you, Ken.